Hey everybody, this is Jason Eagle, your Natural Health Authority, Jason Eagle QRA. If you want to support me, go to my Jason Eagle Patreon. It might be under Strategic Healing or Jason Eagle QRA. This is the Healing Matters podcast. And today we're talking about dental appointments. Dental appointments in terms of get your dental appointment. Get your checkups. There's lots of checkups that you can do. I've recently had a couple, and I'll talk a little bit more later on another episode. I had a heart one done, and $60 for having a heart ultrasound, or what is a carotid ultrasound, abdominal ultrasound, the whole 9 yards, and $60, and that's out of pocket. And there's all kinds of different checkups, but today, dental. You know, most people, there's some people that get their regular checkups, and there's some people that put off, and I'm actually, the appointment that I'm doing today is in the family of playing catch up. So much of what's being done dental wise with me, it would be because I didn't do it earlier. Now you have to do it this way, and an ounce of prevention is worth a pound of cure. So dental checkups, in terms of having somebody check it up, what do they say, like 2 times a year? It's very, very important, and it can save you. Now, I'll tell you that dental has come so far and that dental checkup really has kind of changed a little bit in terms of even fillings. So let's say a person has gone and had their checkups, and they're 50, 60 years old or 70 or whatever, and they go, my dentist says I'm fine. Over the years, I've had all of these different fillings, and I got these different crowns, and I've got root canals and stuff like that, but my teeth work, and or I had a bridge or whatever. Even the person that says my teeth are perfect, I've had hardly anything done. There's always something to do, and especially with the fillings. So let's say a person, so what's the level of, now we understand what is the optimum of dental. And dental goes to everything, especially when you realize that when dental was done the old way, which is metal. So now what's called metal free is the ideal. Metal and infection free. Getting the infection out of there is also number one. You got 2 number ones. The number one would be if you had a filling and metal was put in your mouth. Metal amalgams, that's the silver stuff that's on the inside the tooth. Or let's say a person has a gold crown. That's fine. Well, let's say a person has a gold crown and then has some metal amalgam fillings. Number one, the metal amalgams, which they call silver, they're not. They're mercury. They're 50% mercury. And truth be told is, if you had a 100-acre pond, or I'm sorry, a 1-acre pond out there anywhere, out there in the wilderness, and the EPA went out there and they tested and they found certain level of mercury. That level of mercury would then condemn it, meaning it would not, you'd have to put a fence around it and not let anything drink from it and eat from whatever. How much mercury in a dental amalgam does it take to, it's one tooth. So let's say one of your molars, if they took the mercury and put that in a 1-acre pond, that's the level. Now, the old dentists say, that stuff is safe and it doesn't come out. That's not true. And especially when we now understand there's 2 factors which make the mercury pour into your body. And mercury is a neurotoxin. Mercury you're swallowing all the time. It's messing up your guts. Mercury is a poison. Mercury is making the Mad Hatter. The mercury that was in the hat, the brims of those top hats. That's what made those guys go crazy, and that's why they were called the Mad Hatters, because they were getting mercury poisoning. Okay, well, dental amalgams, my fillings, the good old fillings, have now been replaced with, there's a white material, which is the white composite, it looks great, it looks better, but it has no metal in it. But there's a better material. The problem is if you get a new filling that has composite, meaning it's the white stuff that they literally pour in there and then they cure it with a ultraviolet light, it wears away. and if it's put inside where a filling is, it can crack away and it can form these micro cracks, meaning now we're getting infection up underneath. Because the reason for a filling is you got to get that decay out, because the decay, it will burrow itself down into like the matrix, which is it'll get to the core and now it takes over the system. And then infection, dental infection, when it gets in the bloodstream, has also been, so a bad root, a bad tooth, is literally the source of heart attacks and strokes and all kinds of other things that is literally killing people. So dental is super, super important, okay? And then, so now the newer material is ceramic. So let's say we have a crown. Now we go back to the gold. Gold is fine. Does gold have mercury? Yes. Even the gold tooth actually has some mercury in it, because you have to, what's called an amalgam, which is, it's not pure gold. It has to be mixed with other metals. Some of the other metals are nickel and all. So metal-free is definitely the way you want to go, because any metal in the mouth, now especially in the mouth, because the mouth is acidic. And also the mouth faces extreme temperature changes. What are you talking about? My mouth is, when you drink hot coffee, it goes right to your teeth, or when you drink cold water or ice cream, it shrinks. And so there's this expansion and contraction. And if metal is there, especially mercury, what happens is that metal, then the ions of mercury, the poisons, go and they squirt into the system even more so. Now there's another thing, which is if you have what's called dissimilar metals. I've got a gold one over here, or I've got, let's say, a metal jacketed crown. Metal jacketed means it's like looks like a tooth material, enamel, but the old crowns is they were onlaid on top of metal. That's where when you say I have a crown, you can see right at the gum line, it's dark. Looks black, because that's metal. Well, that metal is inside your mouth. So that metal is inside this battery acid of a tooth or of a mouth, and the acid literally creates what's called electrolysis, and it speeds up the electrolysis, meaning the mercury comes out even more so if you have a gold and a mercury. These are dissimilar metals. So if it's all mercury, a certain amount comes out. If it's all gold, a certain amount comes out. But if you get these two different types of metals, what happens is the battery acid in your mouth literally arcs it, and you then electrolyze. So what's electrolysis? It's like that ring cleaner. When you put it in that water, it goes and it bubbles up and it cleans, because what it's doing is it's causing an electrolysis. Or how do you make colloidal silver? You basically stick a rod of silver and stick electrodes to it and electrify it, and then inside of like purified water, and what happens, it starts to bubble, and literally little parts of the silver is going into a liquid, and now it's silver water, but it doesn't look like it, because it's now turned into ions in silver. So that's why metal free is the way to go. So that means a person goes, well, my teeth are perfect. If you still have fillings, you want to get them taken out, and you want to get them replaced with all ceramic. And now they actually make a pourable ceramic. So instead of it being the composite material, now it's a composite-like material, in that you can pour it and then cure it with the light, but it's made out of nano ceramic that has high levels of what's called zeolite. And zeolite is, especially if you're talking about like the good metal crowns, or I'm sorry, the good ceramic crowns, that would be, now you can have it done in the office where they drill the tooth out, they take the decay out, or they take the old filling out, and then they'll take a picture of it, and then they send it to a computer, and the computer then has a 3D, it's not a printer, what it is it's a carver. And so you're literally carving a brand new ceramic tooth that can be a crown or an onlay or whatever, and it's made in the same day. That's the ultimate in terms of how do you create a new tooth? How do you fix your teeth? And then we have another layer, which is the layer of infection of a bad root or perio, which means the tooth is growing inside the bone. And what happens if you start to lose bone that's around, and that's what creates loose teeth. That's what creates a person getting what's called lung in the tooth. And eventually your teeth fall out, is because your gums are shrinking. But it's not that your gums are shrinking, is you're losing bone. And so they can do what's called bone grafting. Now, what's eating the bone is the infection that gets in between the tooth and what's called the periodontal ligament. And that's infection that grows in there, and they're eating away at the bone. So the next layer up is, can I keep my teeth without having to lose them? And can I kill the infection? Because perio, which is what's growing in the bone around the tooth, that's a number one source of infection in the body that goes straight to the heart. That goes also those infections, so that's why people get the stinky breath, and it smells like arsenic. It smells, and actually it is, it's a gas. These bacterias that live inside the gingival tissue, the gingivitis, is actually cyanide. They create a cyanobacteria, which is they are bacteria that are anaerobic, meaning they live in a place inside your mouth where there's no oxygen, very little oxygen. So they've created an environment, and they live in the environment, and then they're eating away and living inside that area. So they're living inside your gums, inside your bone, and they're pooping and breathing out cyanide gas. Cyanide gas is a poison. That's how you put a person in a gas chamber and you kill them. So there's gingival infection, periodontal disease, is the slow killer, and it's the slow poison of like arsenic and old lace, which is he killed his wife or she killed him. But it's you did it to yourself. So the checkups of finding out, and again with a dentist, I have 5 dentists. There's a general one. It's like for a good car, you're gonna have like 5 mechanics. Why? Because you want a person that's a specialist in what they do. And so the perio is a person that is treating periodontal disease, and what they used to do is going in and scraping that out and blah blah blah. Now they do it with a laser. So now they can shine a laser and kill the bad infection, but also cause a biostimulation, essentially stem cell. And then they can do bone grafting and gum grafting, which is, can you grow it back? So in dental is literally, dental has been on the forefront of medical because, again, instead of a heart transplant, could I grow my heart back? Instead of a tooth transplant, instead of a tooth implant, could I actually save that tooth, and could I eventually even take the tooth out and regrow it back? That's where we're getting into stem cell therapy in terms of how do I get rid of this infection? And dental infection is the worst, and it's the most insidious, and people say, well, I know if I had an infection, I'd be in pain. No. You can have a lot of bad roots and gingival that you don't feel pain at all. And again, the telltale signs is the stinky breath, bad taste in your mouth, that type of stuff. But you can see it as the gums are receding and you're getting long in the tooth. And if you have metal in your mouth, your goal is to live long enough to get a metal-free mouth. And if that means, too, that you even have had... Now, people go, well, what about implants? I had the old titanium implants. Get that metal out, too, because now they have implant. Now, like I said, down the road, we'll eventually get all the implants out, put a stem cell implant, and then you will regrow your own tooth root. But in the meantime, the metal-free dentistry that involves implants are a zirconium implant. Not a zirconium coated titanium, but solid zirconium, which means they drill the hole out, they take the bad tooth out, and then they put in a zirconium, which is a ceramic, basically like a dinner plate, right? But a really very specialized dinner plate material that screws into your bone, and then your bone grows onto it and then adheres to it, and it's like welding it to you. Then it becomes just like what your real tooth was, which is it's living inside your bone and it's welded to the bone, but not really, because it's welded to the periodontal ligament, which allows some flexion. So you're drilling this, screwing this thing into the bone, but you also want it to build up the ligament to allow it, and then you also want the tooth material, which would be zirconium, to metal doesn't have any flexion. Metal doesn't expand and contract. Your real tooth does that. So when you bite down with your choppers, the real living teeth actually have this, it's not solid. Same thing as like a steel girder. The real bridges, like the Mackinac Bridge or the or the San Francisco Bridge, they flex. They're designed to flex. The big buildings are designed to flex. So a tooth is designed to flex. So the material that you want to fill it with or replace it with or all this stuff, you want it to be like the bone, the same hardness of your tooth. So if you have a real tooth chewing on a fake tooth, you want it to chew on one that have the same hardness so that you're not wearing them down. And that's the problem with the composite on a bite surface, is you wear it down because it's soft. So the fillable ceramic, if you can still do that, but if you have to replace it with the crown, the gluable, and it's actually a molecular bonding, so when they put a all ceramic crown on your real tooth, it's welded to the tooth so you don't get cracks in along it. It's not just cemented. And then if you have to have a implant, it is a screwable abutment, or the abutment goes on top of it. The implant is what's screwed into, it's the, the telephone pole that's screwed into the dirt, and then the dirt grows around it, and then you put the tooth on top of it. And the tooth is also a ceramic that is then bonded to that implant, and now you have what they call one piece, and now it's metal free, but it's adhered to the bone, and it has the same expansion and contraction with heat and cold as your normal teeth do, and it's not outgassing any type of metal. It's also not like a little antenna that literally gets affected by microwaves and radio waves. So a titanium implant is essentially anything that's metal, especially a metal rod like that. I don't know how crazy you think it sounds. It's an antenna. It literally is an antenna, and you're picking up on waves, and it can't be good. And your real teeth doesn't do that. And so a ceramic implant, as well as ceramic onlays, ceramic inlays, ceramic crowns, ceramic bridges, all of this stuff, this is the technology that we have. And we do have the combination of the dental guys who use a combination of dental lasers to clean out the infection, as well as cause biostimulation, get it to grow back, get it to produce its own stem cells and grow back, and literally reverse the aging process. But also ozone is also used, which is the mouth and the dental teeth and the gums need oxygen and would benefit. So that's why rinsing with hydrogen peroxide, salt water and hydrogen peroxide bubbles up, and you rinse your mouth with it and swish with it, because that kills, the bubbling up is it killing bacteria. And that's hydrogen peroxide. If you do straight ozone, which is 3 oxygens, it's even more powerful, and oxygen is what kills. So I know some dentists that will inject, not only do they do an ozone gas around, let's say, a bad tooth, or around where we're trying to regrow those gums back or regrow that tooth back, but sometimes too when people have really bad dental infection where it's a rotted part of their bone, NECOs, neuralgia-inducing osteonecrotic lesion. So it can be deep inside the bone from an old root canal, and it's sealed off, and it's constantly leaching poisons into the body. How do you deal with those? What they used to do is they used to do what's called a flap, where they cut open your gum and then they drill it out and pull it out. But the problem with that is that every time you drill, an infection out, you spread it deeper. And so now some of the newer ways is to actually, what they have to, is they inject it. They drill a little pinhole and they inject ozone and laser directly into that, and now it kills the infection, and now the bone grows back without having to do this real deep dental surgery and stuff like that. So it's the technology in dental has really come really far, but it still comes from, you have to get your butt in that chair, and it's scary. I know people where they let their mouth rot apart because they're scared of it, because they had a bad experience. So for that, making sure you're taking care of anxiety, the Tranquinol, Premier Research Labs makes this supplement called Tranquinol, and it helps you to sleep. But if you know you're going to go into a dental appointment, you take, let's say, 4 or 5 the night before, and then you take, up to 8 or 9 right in the parking lot before you go into the appointment. And I so many people, they're like, oh my God, like I slept through it. Normally I'm cringing, and that's what kept me out. It kept the anxiety down, and it helped me. It really helped me to face it. There's a number of other things that you can do, but most people are afraid because of the pain. And dental, really good dental, and I've got the real gentle dentist that you can go and see, like I said, out of the 5, that they really can do stuff where you are not in pain. If you got really bad dental, they actually do sedation dentistry where they knock you out and you wake up, and it's like, wow, and it's safe. And for, so there's answers to your reasons of why I haven't done it and why I've done it, but I don't think I need to do anymore. You don't know, and you want to get it checked up. And infection is really, really hard to find, and especially infection that does not have any pain. It could be lurking there like a ticking time bomb, and anywhere in the body, these things, but especially in the teeth, especially in the dental. It's because, and again, what it can lead to, which is, it is heart disease, it is Alzheimer's, it is strokes, it is diabetes, all of these things that you would think, well, what's that got? It is bad hormones, it is weight problems, it is leaky gut, it is a bunch of digestion problems, is you got bad teeth and you're sucking poisons, and your immune system is constantly going after something that it's being attacked by, but your body doesn't know it. And it's literally stressing out your heart, and it's causing a lot of the atherosclerosis, which is clogging up your arteries, causing a person to. The source has been found in much of it, and somewhere between 80 and 90% of anyone who died from that quadruple bypass that they needed, it started in the teeth. Or the Alzheimer's, where grandma's brain rotted and it fills up the what's called the amyloid plaques and things like that. It started in the teeth. So, and even if we have these processes, people with Parkinson's, I've known people with Parkinson's that the treatment, even the natural treatment, didn't work, but once they fix their teeth, then their Parkinson's and their MS and the Raynaud syndrome and all these other things that they didn't know had anything to do with their autoimmune or their degenerative condition. Cancers, I've known so many cancers. There's so much cancer that starts in the mouth. Dr. Winston Price, which is the Winston Price Institute, he was a dentist back in the early 1900s, I think it's something like that was. And he became very, very rich. And he invented a lot of actually the dental drill. He invented the modern dental drill and a bunch of stuff. But what he did is he went all over the world because he started seeing people come in with bad teeth. And he made the connection, which is it nutrition? And is it the minerals? And he went all over the world. And he found that people lived in third world countries, and people that drank the raw milk and had good mineralized cows and mineralized, check out my last video on quality food. When you have good quality food, they keep all their teeth and you don't get dental infection. They don't get cavities at all. So no need to even do dentist, right? But what he found, though, is that he also did these experiments where he found people that had certain cancers, and he suspected that these cancers linked to certain tooth infection in each tooth, because there's actually, the acupuncture meridians show that each tooth is associated with a organ. So there's a heart tooth, there's a gallbladder tooth, and what he found was people that died from, let's say, pancreatic cancer, there's a pancreas tooth. He post-mortem took their teeth out, took chunks of their dead person's teeth, and then implanted it under the skin of rats and healthy rabbits, and they all got the same exact cancers. Pick or choose which organ it was. He found that infected tooth in that organ meridian, and it manifested that type of cancer. So what that means is cancers are a bacteria. Cancers are a virus. Cancer is a bug that's living inside the body, and it's in particular. So where did the cancers in these people come from? Where could your cancer be coming from? It could be coming from a tooth. And by removing that tooth, removing that infection, that foci infection, and then healing it, the artifact, which is the cancer in that organ, goes away. This is true. This is absolutely true, and I've seen this in my practice, and that is the level of dentistry. It's that important. So get your checkup. Till next time, bye-bye.